Chào mừng quý vị quay trở lại với phần cuối cùng của chương trình Tôi và Việt Nam trên kênh truyền hình FBNC ngày hôm nay với phần trò chuyện cùng ông David Utama là chủ tịch và là giám đốc điều hành của GE Healthcare khu vực Đông Nam Á. So welcome back.
Thank you.
GE is a huge company around the world. We have many different offices in different countries, and you're always working on advanced technology products.
Correct.
But when it comes to emerging markets, what is the difference in terms of approaching the emerging markets? Because, like I said before, the cost of the equipment, the cost of the products is still a big concern.
Sure. Again, I think we've always developed and produced advanced technology. But when it comes to an emerging market, we'll continue to use the advanced technology, but we do it in a different setup that we adopt the same technology, but adjust it to the market need or the local need by not sacrificing the technology, but by changing the whole system so that it will suit the need. For example, right, a big ultrasound, the same technology we use, but we'll make it portable. But doesn't mean that we don't use the same advanced technology. So the same advanced technology is applied to a portable product that is suitable for a country like Vietnam and becomes mobile access, right? We have this new ultrasound device which is called V-Scan. It's the size of a mobile phone.
Yeah, that's very impressive.
Battery operated. In the past, a patient will have to come to the clinic with this advanced technology and more affordable and portable. The doctor can make home visits.
Yeah.
So we can definitely improve access. And we're very proud of that, and we believe that will give a lot of benefits to people in the rural area.
ASEAN's region have a great diversity in terms of healthcare developments industry. Singapore, Thailand, Vietnam, Indonesia. How does that create challenges for GE?
The challenge when it comes to diversity, if you look into disease, I think today everywhere is the same.
Okay.
I think the disease today don't say, I will choose Vietnam or I will choose Indonesia, right? Disease doesn't behave. I mean, today the non-communicable disease is basically the cardiovascular, cancer, or diabetes, right? It's the same everywhere. And if you look into Vietnam today, the non-communicable disease is already 4 times bigger than the infectious disease. And it attributes about 67% of death illness. And we are working with, again, through training beyond the advanced technology of how can we address challenges like this. So the diversity in Southeast Asia or ASEAN when it comes to disease is almost the same. But when it comes to challenges locally, it could be a little bit different. We talked a little bit earlier about the overcrowding hospitals, right? And these are the challenges that we will work with the local government of addressing that. But I think the biggest goal that we all want to achieve is how can we work together and provide a sustainable solution. And I think that's the bigger challenge, so that it's not a one-time issue. It will be sustainable for the long run. And again, we're very happy because the government here in Vietnam is very committed to that. And that's what makes us happy to be here on the ground.
Well, talking about products, I'm excited to see that you have launched V-Scan, you mentioned before, and recently the maternal and infant care products. What's next?
We have, product through the pipeline of new product introduction will continue to come out from the investment we do, right? In GE Healthcare globally, I think the company today is investing about $1 billion every year for research and development. And definitely we will produce a lot of good products, but at the same time, right, we also coming back to the local issue here with the team will help drive what is suitable for Vietnam, right? Because this definitely cannot be driven in the US at the headquarters or in the region. And where the region is supporting the local team is driving that. And so far I've been very pleased because our local team is very active. They meet with all the constituents, they meet with public-private hospitals, they meet with MOH, and they work with the company, with us to make sure that we are delivering a product that meets the need for Vietnam.
Looking at an overall picture of the global healthcare industry, what do you see as some of the big trends that are going to be happening in the next 3 to 5 years?
Well, if you look globally, right, I mean, closer to home in Southeast Asia, I think universal healthcare coverage is a lot of good topic. You know, the whole system of rural healthcare is going to be a big challenge. Even to a certain degree of Millennium Development Goal 4 and 5, which is maternal and infant care mortality is a big issue. So there are few, but again, right, this is where we cannot be alone. A lot of companies have to be involved. Sure. The government have to be involved. Private sector will have to be involved. And we want to be part of it.
Well, thank you so much for sharing. Can't wait to see your next products in Vietnam.
Thank you.
Thank you for sharing. Thưa quý vị, vừa rồi là những chia sẻ của ông David Utama, là chủ tịch và là giám đốc điều hành của GE Healthcare khu vực Đông Nam Á. Quý vị có thể xem lại chương trình này trên website sbnc.vn hoặc là xem lại trên facebook.com/tôi và Việt Nam. Thân ái chào tạm biệt và hẹn gặp lại quý vị trong những chương trình kỳ sau.